International Conference on Urine Therapy. Let us have a big hand for them. So, honorable organizers of this event, respected dais, especially Mr. Narayanan sir, who is the president of Urine Therapy Federation Kerala. Then there was a MLA sir, Stephen sir, which he spoke about the requirement of the urine therapy which needs to be propagated. Then there are certain volunteers here who are working so hard and making it so meaningful. This, for them also, I really salute initially itself. And then there are certain delegates who have come from all over the India, especially Naveen sir, Raju Bansali sir, and urine therapy lovers, brothers and sisters. So here we are there to understand the science of urine therapy. So before we start talking about science of urine therapy, I would like to present myself. I am Dr. Nithinpatel. I am a son of Dr. Shashi Patel, who is a founder director of Shivambu Health Research Institute, Kolapur. I feel privileged to talk about urine therapy because it's a very near and dear subject since my childhood. My father taught me to drink urine since my childhood, since I was 1 year, 2 year old. He has fed me with the spoons. I am a 52 years running person. Okay, my age is 51 year old. I am running 52. And since my childhood, I never took any pill or any injection because since childhood, I am practicing urine therapy. Since last 25 years, I am working as a researcher as well as I am doing a clinical practice exclusively urine therapy along with the naturopathy and yoga at Kolapur. We have a charitable organization named as Shivambu Health Research Institute, and through which we run this Anandpunj Naturopathy Yoga Ashram, that is a holistic center. In this, especially we practice urine therapy. So it's very dear subject for me. Actually, my father, Dr. Shashi Patel, envisaged that urine therapy one day will be internationalized way back in 1970. Actually, he came to know about this therapy from a enlightened master. You can see this his photograph there. He is one of the enlightened master named as Kadasiddeshwar Swamiji. There is one ashram there, Kaneri Mutt, near Kolapur. From him, this knowledge of urine therapy has been bestowed on Dr. Shashi Patel. Actually, this Swamiji was very amiable in 1970 to bestow this knowledge to Dr. Shashi Patel. He gave some books to read, and from then the seed was sown, and later on, since last 50 years, there is so much of research happened because of this Swamiji who encouraged Dr. Shashi Patel to practice urine therapy. Actually, initially there was so much of reluctance from a medical fraternity at Kolapur, but later on, you know that our beloved late Prime Minister Morarji Desai visited our place as a Prime Minister, and he encouraged again Dr. Shashi Patel. At that time, actually, I will narrate one incident and then we will go further. Actually, during that time when he visited, because he was a urine therapy lover, so Prime Minister is coming, so many patients gathered together, and so many diabetes patients, heart disease patients, some cancer patients who got cured, some leprosy patients, they were gathered together. And Dr. Shashi Patel was very happy to show to Prime Minister that these are the people who got cured themselves from a urine therapy. That time, Prime Minister was not interested in seeing those cured patients. What Prime Minister, the leader, what he asked to Dr. Shashi Patel was that, don't tell me that with the help of urine therapy these many patients are being cured. Tell me, Dr. Shashi Patel, how many urine therapy practitioners you trained, and then only what will happen is every nook and corner of this India, there will be a urine therapy center. Only Dr. Shashi Patel alone cannot serve the society. He seen the vision that every district, every tehsil level, there should be a urine therapy center. Then only this vastly populated India, where the poor people needs this free and easy therapy, needs to be propagated. That was his vision, and with that, he took that inspiration from Rajiv Desai, and he kept on practicing urine therapy. Now, when we talk about urine therapy, the first question, actually, it has ancient history. Actually, if you see in Ayurveda as well as different textbooks of yoga, somewhere there is a mention of urine therapy. If we go back to our ancient days, initially all these yogis, they used to practice urine therapy. When we say yogi, that means what comes in our mind, that a person who is doing penance to reach that higher consciousness. And to reach that higher consciousness, one needs a very healthy, pure body. Otherwise, we cannot sit in one posture for a meditation. So to sit in one posture for a meditation, you need to have a clean body. So in ancient days, all these yogis, they used to do some yogic kriyas. You must be heard about Jal Neti, Sutra Neti, Shankha Prakshalan, as well as there is an arm rolling kriya. There is an arm rolling technique, cleansing technique, which is mentioned in Hadyo Pradipika. In that, it is mentioned that one has to drink his own urine for a certain period of time. Okay, and once you be on drinking your own urine, and if you are doing this arm rolling kriya for a certain period of time, automatically what happens, you will have a clean body and you will transcend yourself from a human body to that pure consciousness. So earlier, in ancient days, all these yogis, to purify the first body, our physical body, they used to practice this arm rolling kriya. In nowadays, in last 150 years, people started using this arm rolling technique as a therapy. And nowadays, we are looking it as a therapy because it works. First thing what it does is, it detoxifies your body and replenishes your cells with the good nutrients. That's why it works as a wholesome therapy. Okay, it works as a holistic approach. So that's why urine therapy is the best therapy. Now, first thing which comes in our mind is that as our MLS speech, it has come that there are certain layman's questions which comes in our mind. That the first thing which comes in our mind is urine is waste. It is expelled. So you have to understand that urine is not waste, it's best. Generally, it is being called as a blood plasma. It's a derivative of blood. See, for that, you have to understand what is the difference between a urine and a fecal matter. See, the fecus and urine, both are expelled from the body. But they are different because fecus is outside the body, whereas the urine is inside part of the body. You have to understand the difference between inside and outside. Urine is an integral part of your blood, whereas fecus doesn't have any connection with the blood. For that, we have to understand how the urine is formed as well as how the fecus is made in our body. So when we eat a food, it goes in the stomach, where in stomach the food is broken down. It goes into intestine. In intestine, all that what food we have eaten, that is being absorbed. All those proteins, vitamins, minerals, all those nutrients are being absorbed, and solid waste is thrown out as a stool. So from mouth up to the anus, there is a food pipe. So it is external. So when you put the food, whatever the solid waste is there, it is going out as a stool. So it doesn't have any connection with the blood. So urine, whereas the absorbed nutrients are converted into food glucose, and later on it is assimilated with the oxygen, as well as there are certain blood WBC, RBC, there are certain hormones assimilated, and it is given weight to the different cells of our body, and later on it is excreted as a urine. So urine is a overflow of blood, whereas stool doesn't have any connection with the blood. So though both of these, your stool as well as the urine, both are expelled from the body, but urine is not best, it's best. Why? Because it's a regulated blood, you can say, whereas the fecus which is coming out is best. Now further, when you understand, once you have to understand how the urine is formed in the body. See, whatever we are eating, it is going in our stomach, then later on it is going in your intestine, where it is being absorbed, all these nutrients are being absorbed, it is converted into a food glucose. That food glucose is assimilated with the oxygen as well as different hormones which are there in your body, and then taken to every cell of your body. From that cell, again the urine, this particular pure as well as impure blood comes to your liver. So what the liver does is, this nutrient-filled blood passes through this liver, and where the toxins are removed and later it is excreted from the body in the form of solid waste. So eventually this purified clean blood goes to the kidneys and the urine is formed. So in kidney there are mainly three functions. First is ultrafiltration, or also it's being called as a glomerular filtration. Then there is a tubular absorption and there is a tubular secretion. What happens in urine? If you understand the formation of urine, you will never have any aversion against urine. See, whatever the clean blood which is flowing through the kidneys, what happens is the extra water, extra sodium, extra calcium, extra magnesium, potassium, there are so many amino acids, minerals that is being filtered out in a glomerular filtration, and again it is reabsorbed. So at that particular time, the constituents of the blood which are not required in a blood, that are being filtered, and again later on again they are being absorbed. This is a very intricate, complex system through which the blood filters. You understand, there are in a particular 24 hours 180 liters of blood being filtered in our kidneys. Generally, an individual person has 4 to 5 liters of blood. So that blood, 180 times is 180 liters of urine in a 24 hours it is filtered, and out of which again it is being absorbed, and only 1.2 to 1.8 liters of urine is made, and that is being excreted as an excess product of our body. So this particular phenomenon we will understand in a layman language with one illustration as an overhead tank. Suppose there is a building, you keep one overhead tank over it, put on the motor, what happens? The water starts flowing in the overhead tank. Once the tank gets filled, what happens? The overflow wall is come on and the overflow water is coming out. The overflow water which is coming out of the tank is not waste. Same way, whenever there is extra constituents in the body or any extra water is there in the body, what happens? It comes out as a overflow of blood. So what we can say is urine is a overflow of blood. There is this phenomenon we will understand with the concept of dehydration. Suppose someone is fainted, someone has gone through a loose motion, and person is bedridden. At such a time, how these doctors decide whether patient is dehydrated or not? First question is asked, since how long this patient has not passed the urine? Suppose in last 8 to 10 hours he has not passed the urine, that means what happens? The severity of dehydration is more. So in that case, eating food and then again digested and is converted into blood, it takes time. So at such a time, what happens? What doctors do is they put on the saline water. They put the saline water, IV injections. After the 1 or 2 bottles, what patient says is, take out this needle, I need to go for pee. So whenever there is a overhydration, there is a formation of urine. Whenever there is a dehydration, you never pass urine. So what is urine? Whenever there is an excess thing which is there in the blood, then only you pass the urine. So this is well understood. Now let us understand one example, again one more example, that is a pressure cooker. Suppose you are cooking up rice in a pressure cooker. What happens? After some time, the whistle starts blowing. So whistle starts blowing means what is happening? The steam element which is there in the cooker got heated up and so it is coming out. So extra steam is coming out. The steam is not waste. It is the energy part only which is cooking the rice. So whatever the steam which is coming out is not waste. Suppose if I seal that vent, you take out the whistle and if I seal that vent, what will happen? The cooker will burst. Same way, whatever I eat, whatever I drink, if everything remains in my blood, what will happen? I will blast, isn't it? Suppose if you see a kidney failure patient, what you see, his face gets swollen, legs and hands will be swollen up. And why? Because there is a heavy increase in blood constituents. So you need a regulation. Okay, so there is a safety valve. So this particular kidney, what it is doing, it's working as like a safety valve. And it is whatever is excess is coming out. So we need not to think that it's best. Now we understood how it is not best. Now then people they say that if it is excess, if it is excreted, then why would we want to use it again? That is the main question again it is asked. It is excreted, it's natural process. Why we want to take it again? First thing we have to understand, the various elements in our blood is balanced by taking out this urine in our blood. So the kidneys do not filter out important elements in the blood because these elements in themselves are toxic or poisonous or bad for the body, but simply because the body does not need that particular concentration of the element at that time, that's why it is excreted. And the medical researchers have discovered that many of these elements are in the blood which are found in urine have enormous medicinal value, and when they are reintroduced orally into the blood, that is not going into the blood, it is going into your digestion tract. As if you are taking a food supplement, as if already the body which has processed your food, when you are drinking urine, you are taking it back. So there is a, suppose for instance, kidneys filter out water, sodium. Is water toxic or the sodium is toxic? See, they are the very important vital life sustaining elements without which our body cannot function. But these both elements could be lethal if they were too much water or sodium in our blood. So there are other minerals also. So when you take it, ingest it back and orally, what happens? As if you are taken the food. Okay. So there is no need to worry about that if it is excreted, then if you take it back, it is harmful. It's not harmful, it's harmless because already this body has processed your food. Now there is one more question which comes in our mind is, urine has a urea, creatinine, uric acid. These are the nitrogenous substances and they are harmful. Actually, the principal organic solid in urine is a urea. So through which only the name urine is come. Actually, if you see, there is a formation of urine, the content of urine, that is 95% is water, 2.5% is urea, and rest 2.5% are other minerals and amino acids. So these particular urea, creatinine, which they consider it is a waste product, it's even been considered to be dangerous or poisonous, but this theory is completely untrue, because whatever urea which is found in our body, it helps to use protein more efficiently if we take it back. And one more thing is, urea is a natural antiseptic as well as it's a best diuretic. Okay, so first thing what it does is, the nitrogenous compounds which are thinking harmful, what it does is it cleanses. Especially those who practice urine therapy, they will gladly share the joy of empty bowels. Okay, first thing you will enjoy is you will never have any constipation. So what the urea, creatinine, and as well as the some uric acid which is found in the body, it works like a laxative. That's why first thing which urine therapy does is detoxifies your body. in naturopathy the principle is any disease is because of the accumulation of toxins. And if these toxins are removed, the foundation of any disease is removed, automatically what happens? The building of disease will vanish. So that's what, in that way it works. So you must have heard about the anti-venom injections. Okay, if any snake bite is there, so what happens? The doctors give anti-venom injections. In that anti-venom injection, what is that? Okay, this injection is made of some snake poison only. So poison removes poison. So whatever the urine contains, the nitrogenous substance, they are very less amount, but if you recirculate it, it helps. Now, there are so many urea-related ingredients which are found in urine. That is, one more name is, which is carbamide. This is a chemical name of synthesized urea. Especially this carbamide is used for a wax removal system. That is, carbamide peroxide is made out of synthesized urea. Synthetic urea and hydrogen peroxide is used to make this particular drug. Then there is a, whatever the urea which is found in urine, human urine, is a good skin moisturizer. Okay, especially in urine therapy, we apply old urine as well as fresh urine on your skin. Suppose you must have heard in the market there are so many skin moisturizers, oil-based skin moisturizers. Those who suffer from a dry skin or a hair fall, they use this particular concentration. So all this, what this oil-based moisturizer does is only sit on the skin and that doesn't absorb. Whereas the urea-based moisturizers which are there, what it does is it improves the hydrogen bonding capacity of your skin. The pores gets open, and what happens? This particular oxygenation of your skin is improved, and that's why it's the best skin moisturizer. See, there are many skin moisturizers available in the market, and that skin moisturizer contains synthetic urea, and the synthetic urea source is human urine. So many, especially the ladies, go to the parlor and they do the facial and they do use many moisturizers. In that moisturizer, there is so much of urine used. Somebody else urine you use and you buy from the market by giving of money. And when I tell certain ladies that you use your own urine for a massage, they ask many questions. So you are using somebody else's urine on your face and you are not ready to use your own urine on your face. That is the difficulty, isn't it? Now there is one more ingredient, uric acid. Okay. So University of California, that is Berkeley, reported in 1982. There is one medical research paper available. In that it says that uric acid, which is found in urine, is a defense against cancer as well as the aging process. There is one more Omni magazine which has published one paper in October 1982, which says that uric acid could be one of the things that enable human beings to live so much longer than any other animal. So uric acid, which is there in the urine, when you take it back, it reverses your age. The aging process is stopped. That's why you will see that many urine therapy practitioners, they look young. Why? Because of this content which is found in urine. So I think we can say that urea, creatinine, uric acid found in human urine may seem poisonous, but recycling them orally into our body is totally harmless. There is no question. Now, if I ask you whether you practice urine therapy, many of us, you will say you no. But with the confidence, I will say that every one of you sitting here have already practiced urine therapy. You know that? Already you have practiced urine therapy. When? In your mother's womb. Okay, in mother's womb, the fetus which floats in amniotic fluid, that amniotic fluid is nothing but fetus' own urine. If urine tract of a fetus is blocked, what will happen? That fetus will not pass the urine and it will not come in the amniotic fluid, and due to which what will happen? The lungs of the fetus will not be developed. There is one more research, that is New York Times medical section of August 16, 1986, which published one report, and in that it is being said that urine is the main component of amniotic fluid. That is Also, it is being discovered that there are certain surgeries carried out in a mother's womb inside. Okay, so whenever there is a surgery carried out in a fetus, the scar doesn't leave there. The scar also it vanishes. Whereas when fetus comes out and you do any surgery, generally the scar remains. So there is one William Poole, one scientist who wrote one book in the name as Heart of Healing, which he has explained that certainly if we use human urine, the patient's own urine after the surgery for as a urine pack, what will happen? Even the surgery scar also will not remain. Why? Because there are certain contents in the urine which helps to heal any wounds in the womb. Now, what is the principle of urine therapy? As I said, there is a 95% water, 2.5% of urea, and 2.1% is mixture of minerals, salts, and hormones. So only urea is the substance after which the urine is being named, and generally it is we are understood that it is not poisonous. And whatever in small amounts, whatever we take it into the body, it purifies, it clears up the mucus, and has a number of specific useful effects on our body. So urine is basically it works as a natural medicine. You must have heard about the medicatrix nature, the modern medicine's founder, director, that is founder of Western medicine, that is Greek doctor Hippocrates, which often referred to self-regulating power. So urine therapy basically improves our self-healing power, especially in COVID-19. During pandemic, we have seen those who are practicing urine therapy since many years, they had a self-healing power in themselves. So it develops that. So first thing we have to understand, if we have to how urine therapy works, the first thing is it works like a natural medicine. Now, how urine therapy works? We are understood it is not best, how it is best. There are certain, it's harmless, we are understood. Now, there are certain things, how it works. There are several hypotheses by several scientists. Until then, they have been put. It works as a natural nutritional supplement, antiviral effects it gives, antibacterial it is, antivirucidal it is, as well as it is being said that hormonal balancer it is. There are so many things. Okay, so already we have understood. This slide explains that urine, how it works as a laxative as well as cleansing agent. Because when we take the urine, it helps the intestinal flora. Actually, whatever digestion happens in our intestine, it's because of a lactic acid bacillus. So when you ingest your urine, first thing it does is it balances our intestinal flora, and that's why the digestion happens is very good, as well as the cleansing process happens is very good. So it's a good laxative as well as cleaning process as well. Then urine works as a nutritional supplement. We obtain different minerals, vitamins, other nutrients in sufficient quantities, both from food we eat, assuming that as we follow the well-balanced diet, by drinking urine we possibly reuse and reabsorb these number of vitamins, amino acids, salts and hormones in our body. Then it's a good hormonal balancer. You must have heard about melatonin, okay? Especially morning first urine. There is one scientist named as Mr. Nakao, who is in Japan, who runs one institute named as Miracle Cup of Liquid Institute. Miracle Cup of Liquid Institute works on urine, human urine. He discovered that there is a pineal gland in our brain which secretes melatonin every morning. What this melatonin does is, especially in the morning, you feel very fresh, very good. Why? Because this melatonin is secreted. But that particular melatonin is found in morning first urine. So if you recycle that morning first urine, what happens is the melatonin you get it back, and because of that, throughout the day your stamina will be better, you feel rejuvenated and you feel fresh. Why? Because there is a melatonin. So only one melatonin which we are discussing. As the science progresses, there will be so much of involvement of so many instruments. So we will be coming to know there are so many hormonal things which are coming out. First thing we have to understand is our urine is a mirror reflection of our body. So there are so many hormones, even little, see, making hormones, so creating formation of hormones takes a lot of energy. Okay, so little bit of hormones, if we take it back, it will alter all our personality and all our psyche as well. So urine therapy works as a hormonal balancer, especially those who are, especially in female patients, what we see, there are so many PCOD problems, there are so many menstrual cycle problems, there are so many infertility cases, and what their works is this particular hormonal balancer factor works there. Then there is a reabsorption enzymes. One enzyme I'll talk about, that is urokinase. If anyone suffering with a cardiac problem, if anybody gets any myocardial infarction or a neurological infarction, if you go to the doctor, first injection is given as urokinase. One injection costs 2.5 to 3.5 rupees. Okay, sorry, 3,500 rupees, 3,500 rupees. One injection. So after 6 hours gap, almost 5 to 6 injections they give. This particular injection is made of human urine, totally human urine injection. What it does vasodilation of your cardiac muscles, vasodilation of your coronary arteries. So because of that, what happens? The clotted blood is removed and patient becomes sick. So this human urine injection, we use it in emergency. So if you take human urine regularly, what will happen? The enzymes will purify your blood. It makes the blood will be kept thin. You must have seen nowadays that after the age of 40 or 50, everybody is given two medicines. First one is blood thinner tablet and second one is multivitamin tablets. Do you agree with me? First one is blood thinner tablet and second one is multivitamin tablets. At the age of 40 or 50, everyone is given. Do you know these two tablets does a multi-billion dollars business in the pharmacy industry? There are many chemists friends, they say that with these two drugs we are doing big business. If you drink urine, what will happen is your blood will always remain thin. We are seeing many patients, those who are having a cardiac problem, those who are told to go for a angioplasty and bypass surgery, 90% blockage, 100% blockages, they were put for a urine therapy program for 10 days and later on they were given the treatment regimen to follow at home for 90 days to 6 months, and we have again taken the angiography report and we have found that there is no more blockages. So we have seen that. Okay, there are certain reports I will show you later, but this is why, because this enzyme factor which is very important. Then urine therapy has an immunological effect. Clearly we understand that urine is not toxic, although some toxic ill substances might end up when somebody is ill, but those especially those end substances possibly contributes to the effectiveness of urine therapy as an immunological factor. You must have heard about vaccination, as after the COVID-19 everybody is knowing about the vaccination. What is that vaccine? Vaccine is a ill substance of that particular virus. When it is ingested, automatically what happens, in our body there are certain antigens or antibodies are being created. So whenever you are ill, if you take the urine, what happens? It becomes like a biofeedback, and your defense system, your immune system is instigated and it works like a antigen, it works like an antibodies. So it has the immunological effect. Urine also works as a bactericidal as well as virucidal effect. As we know, there are certain, again the importance of urea is very important, because the urea is converted into ammonia, and this particular factor, it works as an antiviral, antibacterial effect, as well as it has a diuretic effect. Those people who are not able to pass urine, certain metabolic changes happen when you drink your urine and it flushes your kidney, and that's why we can say it's urine therapy is a diuretic effect. Then there is a transportation theory. Okay, this one we have to understand that urine can be considered to contain an exact holographic picture of the body fluids and tissues. The biofeedback of this holographic information by re-ingesting the urine may well inform the energy system in a way which helps to restoring the disturbed balance. whenever you are ill, it's a chemical imbalance. So to balance that, you need a urine therapy. Now, we understood how it is harmless, we have understood how it is scientific. Then general question is come, that urine therapy is so awesome, then why it is not supported by science? Why doesn't my general practitioner doctor tell me to use my urine? Why don't the specialists advocate the urine? That is what the general layman public question is. But after knowing the significance, we have to understand that urine therapy is totally scientific. In fact, there is no other natural substance in the world which has been researched as much as human urine. Historically, the medicinal use of urine was quite well known throughout the world. There are many reports that date back thousands of years which extol the virtues of urine both as a diagnostic tool or as well as the medicinal treatment for wide variety of diseases, non-healing wounds and skin disorders. And yet even today, even after nearly 100 years of consistent, authoritative, modern medical research showing urine is one of the simplest, cheapest and most effective medicinal substance in existence. The vast majority of us, including even our own doctors, still mistakenly believe that urine is nothing more than a waste product, whereas it is a best product. Why? Because there are so many medicinal medicines made out of human urine. There are certain medical journals. There is a JAMA, Science. There are so many medical journals. Until now, there are so many research papers are being published. In this, there are thousands of papers. Okay, in urine analysis in clinical laboratory practice in 1972, they have published that it attested that, which is that low molecular weight constituents of human urine. Okay, there are 1,000 technical and scientific papers related to low molecular weight substance which is found in urine, and in one single year there are many research papers published. So it is already recognized by scientific world, but normal layman people are not unaware of it. Now let us go further. It's a financial boon for our custodial industry. With so much of confidence I say, because there are so many, there are 250, more than 250 known drugs which are made out of human urine. We shall discuss a little bit about that. First one is urokinase, already I discussed. Then there is a CDA2, which is Chinese researchers, they have developed one injection again which works against cancer. Then there is a pergonal. Actually in August 1993, this Vogue magazine has published one article. In that they have talked about this Ares Sareno company. This is a multinational company which forms this pergonal. Especially in Europe, there are 26 collection centers there. In Italy, Spain, Brazil, as well as Argentina. And what they do is they collect the sample of post-menopausal ladies patients' urine, and they collect that, and out of that, one component that is isolated, that is named as ovulation enhancing hormone, and that hormone, with that hormone, this pergonal injection is made, and with that, there are this particular drug. What it does, it removes the infertility. Especially, we have seen in our institute, there are hundreds of cases. Those who are having fallopian tube blockages, as well as those who are having a hormonal imbalance, because of that, those ladies patients who are not able to conceive the baby. For such a patients, what we have seen is just within 3 months of urine intake, their hormonal balance is made and they are conceived. So we have seen many medicines are there. Then there is one medicine named as Urine. It works as a diuretic. Then there is one medicine named as ureapolotropin. So there are many gynecologists, they come to us, and whenever we discuss with them, and straightforward I ask the question, do you use pergonal, do you use ureapolotropin? They say yes. Then the next question I ask is, this particular drugs, out of which what is the content of it? They say human urine. Then once human urine ingredients used, drugs you are using, why not you tell the patient that you start drinking your own urine. Then they say that we never thought in this way. Because doctors they know, but generally they don't think in that. So there is a further pyriastine, amino curve, pimarin, pinafil. These are the medicines. Then there is an antineoplastone. Already we had discussed about this injection. Then there are certain medicinal substances which works like as we said, urea, uric acid there, nitrate is there, ammonia is there, minerals are there. Then there is a cortisone. So we will not go in detail. Already these particular combinations, this medicinal substances already we have published in many literatures. You can go through this. Okay, these are the medicines. Further, I will discuss about this. Now, this is in US. There are two companies, this Potajon and Enzymes of America, who has public urinals to collect this liquid gold, this urine. By now, it must have been surprising you that as it seems urine to have an amazing history in traditions as well as modern medicine. So obviously, most of us operating under the gross misconception when we wrinkle our nose at the top of using urine as a medicine. Okay. So urine therapy works like a biofeedback. This one also we understood. Now there is a comparison chart I made. This is the comparative chart of blood and urine. So whatever the content in urine, same or in less amount, it is there in the urine. So whatever is there in the urine, same is in blood. So if we had a sophisticated instrument to detect each and every product present in the urine, we would have get a best scan of functioning of the billions of cells present in the body, and perhaps we will know the complex role played by the body to restore health. Okay. Now there is one more medical research paper. It is published in Elsevier that how urine therapy works in patients suffering from a cancer. Especially we have seen there are many antibodies or antigens found in human urine of a cancer patient. Okay, especially as we are practicing last 50 years, there are so many cancer patients. They come in our place, and they do visit our place and practice urine therapy. So this particular research paper, which is published in April 1997, which supports that urine therapy is very helpful in treating cancer patients. Now, these are the certain cancer patients antigens which we have found in a cancer patient urine. There are certain antigens like UTAA, PSA, then MAB and CA. These are the antigens. Some of the antigens I have put on a slide, just you can go through. Then, so in conclusion, we can say that over the years, urine therapy has been proved to be an effective tool for healing. Actually, urine therapy has been evolved by its practitioners in the clinical situation rather than in the academic establishment, largely by the observation of human conditions in health and disease, and its therapeutic methods have been established by practical experience. Therefore, it is not always possible to explain how it works. Although most urine therapy procedures do have a sound physiological basis. So there may, however, be some statements of urine therapy believers which can't be supported with the scientific evidence. But it would be a far greater mistake if we disregard this phenomena simply because we can't yet just explain them. So we just understood a lot of research has happened. It has an ancient history, it has a modern history. We have understood urine is not waste, it's best. How urine therapy works. There are so many scientific research papers on urine therapy. I hope there is no disgust, no aversion left. So now further this application part, how it is to be applied. That is we will further discuss today, tomorrow. But here in an initial process, I would like to share some case studies, certain cases which will really feel interesting. You will have a great interest in the urine therapy. See, at our institute, we are urine therapy. We are working as a medicine. Anandpur is a place where urine therapy is extensively used and experimented. So it's preventive and holistic health center, perhaps India's only of its kind, where the practice of ancient science is kept alive, research and practiced in its original form. So there are thousands of patients with various diseases are effectively and successfully treated using integrated approach of urine therapy at Anand. Now I would like to present some cases here. You can see a patient's foot. An elderly person had a non-healing diabetic wound on his right feet. Despite all modern treatments, it was deteriorating and he was asked for amputation. Okay, he was treated at Anandpur for 1 month. Then he was given an integrated follow-up regimen followed in for 4 months at home. And now you can see, now his wound has completely healed and you can see a smile once again back on his face. Yes. Now there is one more, he's a tractor mechanic. Aged 28 years, had an accidental non-healing wound on his left leg. Despite all modern treatments like skin grafting, he has done. He's a tractor mechanic, poor fellow. In 1992, he spent almost 2.5 lakh rupees for this skin grafting and all that. But condition got deteriorated. He was treated at Anandpur for 1 month. His condition was such, it was so foul smelling that even his room, only the door remains open, the whole hospital used to get foul smell. So it was such a bad condition. Some doctors, they have misled him or go for a skin grafting. He was put on a non-vegetarian food and because of that condition again deteriorated and he was put on totally natural diet. He was kept for 1 month total fasting on urine therapy. Okay, and now you can see he's still alive. He's working in Satara. Okay, he's a mechanic fellow and his leg, amputation of leg was saved. Now one more thing is the non-healing diabetic ulcer. You can see, okay, healing sickness of diabetes ulcer, especially those who suffer from a type 1, type 2 diabetes and they get the wounds on their legs or hands and due to that sometimes people, doctors, they ask for amputation, but such a type of gangrene patients can be saved with the urine therapy. Now there is allergic eczema on her back. There was always there used to be some purulent discharge on her back, and within 6 days the patches of eczema has gone off. She also was put on a fasting for 7-8 days totally on urine, and this is the result. The one more disease you must have heard about, psoriasis. Especially it's very chronic disease. Generally in Ayurveda, homeopathy or as well as the modern medicine cannot cure this particular psoriasis patient, but with the help of urine therapy there are so many hundreds of patients we have cured. See, psoriasis is a very shabby looking thing, and especially people get psychologically depressed if they get this psoriasis, but there is a hope of urine therapy. So especially the old matured urine is to be used for application, as well as such a type of patients we have to put for a long fasting. Especially in psoriasis, what we see is there are 2 major factors. First one is those people who are always constipated, they suffer from psoriasis, as well as the person who is always anxious, having a depression, psychologically always anxious, such a people also they get a psoriasis. So with the help of urine therapy, the root cause, that is constipation, is treated, as well as the psyche is changed, automatically the psoriasis goes off. So here there is a irritable bowel syndrome. Okay, the person is a young man from Delhi, aged 30 years, was suffering from an irritable bowel syndrome due to ulcerative colitis. Almost for 4 years, he was diagnosed and treated in All India Medical Sciences, AHIMSA in Delhi, the premier medical institution. However, his condition was deteriorating, and then he came to Anandpur for 10 days inpatient treatment program, and within 4 months of follow-up regimen, you can see from 30 kgs he went up to 47 kgs in just 3 months. Okay, and you can see the change in him. Then there is one more case of ulcerative colitis. Okay, she is from Sangli district, ulcerative colitis. She was admitted with severe weakness. She was not able to get married because of her condition, and after the treatment, her weight from 24 kilo increased up to 48 kilos, and later on here hemoglobin was almost less than 7.2 grams, and later on it has gone up to 12 grams, and most importantly, after the age of 30, she got married and she has her own life, a very good life, leading a very good life. Now, this is one more case of viral meningitis, and because of meningitis, his both limbs got weak and he was not able to walk. And such a patient, within 6 days, started walking. Now you can see there is one photograph. He's climbing the staircase with the help of urine therapy. This is the miracle. This is the miracle we say. I have some different reports as well. Now there is a ischemic heart disease patient. He is from one of the silver merchant residing in the Kolapur district only, suffering from a double vessel coronary artery disease as well as the gout. He always had a chest pain and severe joint inflammation due to gout, and he was given 10 days due to fasting and integrated immune detoxification program at Anand. And he followed the given natural diet and yoga regimen, and within 6 months you can see there is a first one is angiography report, and later on there is a corono angiogram. In that there is no more blockage left. So these are the two reports. Then there is one more lady who is 46-year-old from Ratnagiri. She was having blockages in her coronary arteries. She also got rid of her blockages with the help of urine therapy, and there is one more angiogram report which you can see. Then there is a elderly lady who is 60-year-old. She went to US to treat her. There was a blockage in especially main abdominal aorta and lower limbs blockages were there, and she was not able to walk as well as to stand properly. And with the help of this urine, now she is able to walk 10 kilometers in a day. Okay, that was the miracle, because doctors all suggested for a surgery, but without surgery, her reports you can see. Now there is avascular disease, especially after the corona pandemic. There is a sudden surge of avascular necrosis of hip joint as well as certain musculoskeletal diseases we see. Why? Because there is so much of use